Hi everybody, welcome back to our channel. So I am officially 6 weeks post-op, and I figured I would do a quick little update as well as do's and don'ts that I've learned over the recovering process of the mini tummy tuck and liposuction. So I had my 6-week post-op appointment with my doctor this past Friday, and I feel like I'm far enough along that I'll just go ahead and say my plastic surgeon is actually Dr. Francisco Sanchez Navarro in the Tucson area. So highly recommend him. I actually had my appointment with him last Friday. He really loves my results, which is awesome. I did ask him, and I'll put some footage in here so you guys can see. I'm noticing a bit of discoloration right in my, like up here at the upper part of my abdomen and a little bit on the sides. And before I discussed this with him, I had been reading up on it online, and it tends to happen for people of color. They run a bigger risk of it, but it's just discoloration. Typically goes away on its own, but if needed, I was talking to him about it. He said if you really have a problem with it, there's creams that will lighten that skin. It's not the biggest deal to me, and like in person, it's not that obvious, but like in camera, it kind of shows up a little bit more. So I'll just continue letting myself heal. I mean, I'm not ready to start any regimens really unless I just don't see an improvement on it. But that was the only concern I had. He said it's like a low likelihood of like less than 5% of people who actually have it stay. Usually just part of the healing process brightens on its own. So that was pretty much it. He did clear me from wearing the compression garment, aka faja. I only have to wear it at home now, which I work from home and obviously live at home. So I plan to just wear it at night. And other than that, I'm back to being able to work out, which was awesome. And then just keep up, essentially what I'm doing for the healing process. So that was pretty much it. Now let's get into the do's and don'ts. So first do is I highly recommend going with a board certified plastic surgeon. I think this is really important so you can feel confident in the procedure you're getting done with somebody who has the education and background to give you the best results possible. I do know that some people are specialized in maybe liposuction fields and don't necessarily need to be board certified. I just don't know if that's the best choice to go with. So just for your confidence, I would highly recommend that you use a board certified plastic surgeon. Second, I would say, which is also very important, is please follow your surgeon's post-op care. I've read and seen so many different things after my surgery. I didn't really look into much before I had my surgery, but afterwards I've just been curious about how other people look and their results and, what they did after surgery. So I've just been reading and watching a whole bunch of stuff, a whole bunch of videos. And for the most part, the surgeons typically have like a baseline of, suggestions and recommendations that they have for all their patients. But, surgeons differ widely, I think, in the faja area of how long you should be wearing your compression garment, everything that goes into your post-op procedures and recovery. So I would highly recommend that if you spend a lot of money with your plastic surgeon, just follow their advice. You're going to see a whole bunch of information out there on the internet. And I have seen like some people who are like, my plastic surgeon said this, but I decided to do this instead because I read up on it. I just don't think that that's necessarily wise. The way I see it is my plastic surgeon knows my body. He wants the results I want. So I'm going to listen to him because he clearly has my best interest at heart. Not that other plastic surgeons don't, but he's really seen your body and understands it better than the internet does. Just make sure you're following your surgeon's advice. You spent money with them. You're trusting them with your health. Just follow through with whatever they recommend because they're really wanting the results that you want as well. Another big one is make sure you have somebody with you after the procedure. So during recovery, you're down and out for a couple of days at the bare minimum. I know I was like walking around and I felt pretty decent the day after surgery, but it's still hard to get out of bed. And actually, the night of surgery, got sick. So I was drinking a lot of water, trying to stay hydrated, and it ended up making me sick. So having my husband with me, he took care of me, he cleaned up, and just having that extra person with you who's going to care for you and you're comfortable with, and they're just going to help you with some things that you can't necessarily do yourself. That is really important. Just make sure you have somebody who will be taking care of you and you have that planned out prior to your surgery date. So some advice that I saw that I actually didn't do myself, but I think is good advice to pass on, is plan for protein shakes for the first couple of days after surgery. I didn't do that, but I was super nauseous and I didn't feel good. And I'm thinking in retrospect, if I had had a like protein shake readily available, that might have been the nutrients I needed without all the energy of trying to get out of bed and eat a full meal. I wish I had seen that prior to my surgery, because I definitely would have done that. I think it's easier to keep down like a little shake you can drink versus having to eat food the very first couple of days. It's just you're nauseous, you're tired, you're sleeping a lot, your body aches a little bit. So just making sure that you can put nutrients in your body, but not having to overextend yourself in doing so. I thought that was pretty good advice I saw, but didn't actually do. Another big do is make sure that you're at your goal weight or very close to it. Tummy tuck and lipo, they're not weight loss. You're not going to go in and like get a huge weight off of your body and then all of a sudden you're skinny. You have to pretty much be at your ideal weight. Otherwise, your results just aren't going to be good. I had 2 liters of fat taken off of me, so that's about 1 pound. The weight loss had to be for me. So my goal weight was 125. I went into my appointment at 131, and now as of today, I'm 120. So I've lost that weight on my own. It was not anything from the procedure. Again, I only lost 1 pound from the procedure itself, but it was just making sure that I'm taking care of myself after surgery. Just don't anticipate that this is a cure for maybe bad habits, or if you're wanting to lose weight, you think that this is an alternative to that. It's not. It's pretty much really making sure that you're at your goal weight and just tightening up that area afterwards. So that's pretty much what the procedure is. Okay, so another do is just anticipate that there will be some extra costs. I had actually gone to 2 different plastic surgeons before I booked my appointment, and in both consultations I wasn't necessarily told about the compression garments and the abdomen boards. It wasn't till I went in for my first day post-op appointment that the plastic surgeon took off all my bandages and everything. He looked at it and then he was like, okay, you look great, go ahead and purchase a faja and start wearing those. And I'm like, wait, what? So he gave me some suggestions of the brands he really likes, and he sent me on my way. So I looked them up on Amazon. I was like, ooh, they're like $100 each. So just anticipate that extra cost. I did not. I mean, that might have been an oops on my part. Maybe I didn't do my research correctly, or maybe my plastic surgeons could have filled me in that was going to be an additional cost on top of my procedure. But the fajas, I was going to talk about them real quick. So I ended up buying 4 just because it's summertime and I don't want to be in a faja all day and just not have time to wash it, because you're supposed to wear them 24/7. So I actually bought 2 of these. These were the ones that the plastic surgeon recommended, which was the Marina brand. So if you look at them, they go right underneath your breasts for a bra, and then it has snaps down here, and they're super stretchy. So I have a black small in this one, and then I have a extra small, which actually works best now, of the nude color. I found that I really liked wearing these during the day just because it has the snaps down here. So when you needed to use the restroom, you could just snap it and use the restroom, pull it up a bit. These are, I think, $100 or close to it. So these are not cheap, and I was not anticipating the cost of this. And then I have 2 of these. My black one is actually in the dryer right now, but these I actually bought from Walmart. These were cheaper. These were like $70. And the reason I recommend wearing these at night is, 1, they're a little bit more of a compression, so they're not as loose as the other 2. And secondly, it just has like a hole right here to use the restroom, so you can't pull this down. So I like to wear these at night so that I'm not using the restroom at night. So I do like this better for the nighttime, the other one's for the daytime. And then I just feel a lot like skinnier when I take this off in the morning. And then it has, like I said, the hole right here, and then these actually go a little bit further to your thigh. So I like these, like I said, for nighttime, daytime for the other 2. You don't have to buy 4. I bought 4 just because, like I said, I wanted to alternate through them a lot. It's summertime. I get, grossed out by having to wear the same one over. And then another thing that I wasn't anticipating in cost was the lipo or the ab board. So I have 2 of these. I didn't buy, there's like a couple other things you can buy, the foam boards. I didn't buy the foam boards, but I did buy 2 of these abdomen boards, and I actually washed these by hand every day after I wore them, and so I alternated between the 2. These are like $11, but so far $500 in extra cost of fajas. Another thing that I did anticipate buying was the silicone tape. This was over $100 as well. I think it was like 120. So overall, I mean, my 4 fajas, my abdomen board, and then my silicone tape, I spent $500 to $600 extra dollars I wasn't anticipating spending. So just keep in mind, I mean, you don't necessarily need to buy 4 fajas like I did. Maybe you can just alternate that one, especially during the colder seasons. You probably don't need 4, but it was just what I felt most comfortable having and switching through. And it, like I said, it wasn't an expense I had anticipated. So I spent $7,500 on my surgery and then an additional $500 there. So, you know, my surgery ended up being $8,000. So that's just something to keep in mind. It's pretty typical. I don't see anybody who's not wearing a compression garment after surgery, but I didn't do a lot of research prior to surgery. So it might have been my fault. I mean, who knows? It probably could have been, but just expect that there will be a couple more things you have to buy after surgery. Wear your compression garment as instructed by your plastic surgeon. It's really important you do that, especially because I've seen a lot of plastic surgeons vary on what they think is best practice for your compression garment. But, you know, again, you spend a lot of money for your plastic surgeon and for his procedure or her procedure. So just make sure you're following their guidelines and their instructions so that you can get the best results. So that's just an easy one, but it's one that I see a lot of people slip on. Just make sure you're following your plastic surgeon's advice on compression garments. The next one is kind of like a no-brainer, but it's also very important, is hydrate, hydrate, hydrate. I drink a lot of water daily anyway, but I made it a point to stay hydrated throughout this entire process because I didn't want any swelling or excess swelling. I didn't want to be bloated. I really wanted to, you know, release toxins, release the fluids so that I could really heal properly. And in order to do so is a lot of hydration. So I make sure to drink lots of water, and I make sure that I'm, you know, just really staying hydrated with fluids so that I can just beat the bloat, I guess. And I think that really has helped. I haven't had any bloating. I know that a lot of folks do talk about bloating up until a year after surgery, and I probably won't see my full results for another, you know, 5 months or so. But I am really happy with my results. I don't have bloating, and it's because I'm making sure to drink lots of water. I didn't anticipate the recovery process taking so long. I really thought that I was going to go in there and get the lipo. I'm laughing now because how silly it was that I thought this, but I thought I would just get the lipo, the tummy tuck, and just be done, you know, have a week down and out and feel good right afterward. But I didn't realize I was gonna have to wear these compression garments and these ab boards and, you know, still some tightness in my stomach. I didn't anticipate any of that, and I think that was a big don't because I didn't realize the commitment it takes to get your body well after surgery. Don't expect that this is an easy process. Don't expect that you're going to see your results immediately. And don't expect this to be an easy road. My C-sections were a lot easier than my recovery process with tummy tuck and lipo. And I didn't even get the full tummy tuck. I didn't get any of the restructuring of the abdomen wall. Was it more painful? No, but it was more pain in the ass, really, to recover from this surgery. So just keep that in mind. My last don't is just lay off any alcohol or like junky food. The reason I say that is, and obviously you shouldn't be mixing alcohol with prescription medications, so I'm talking more after the recovery process, the initial prescription medication process. But just laying off of the junk food and the alcohol, just so that your body has that time it really needs to recover and release the bloat, and you can see your results a little bit better when doing that. Okay, so my don'ts were really little, so I had a lot more do's in there, but that's just because of things that actually worked for me that I just wanted to pass along. And I'm hoping you guys have a great journey, or if you're just interested in, you know, everybody else talking about their testimonials. Overall, do I regret it? Not in the slightest. I would do it 1,000 times over. I love my results. I love how I look. My confidence, like literally, that was probably what changed the most, is my confidence. I went from constantly hiding myself and being ashamed of what I look like and just hating part of yourself, to now I just feel so good. I'm so confident. Like I feel amazing, and you know, I'm just grateful for that. I'm so grateful that I got this procedure, that I was able to get this procedure. The recovery is going so smoothly. There's some hiccups, but for the most part, this was an amazing experience. and definitely one of the best things I've done for myself. Really wish, if you're watching this video because you're curious, yes, do it. Just make sure you're finding the right plastic surgeon and you feel comfortable doing it. But I am very happy with my results, and I can't wait for maybe that 6-month check-in with you guys. But until then, thanks for watching.